day that Victoria has recorded 0 community transmissions of the coronavirus. That's an amazing achievement given where Victoria was just a few short months ago. That's a precious but wonderful achievement, and I want to thank all Victorians for their efforts and reassure them that the Victorian Government and the Victorian community will take all steps necessary to protect that hard-won game. And of course, as we've seen in recent outbreaks in Sydney, this pandemic is far from over and still has a long way to go. This pandemic isn't over until all Australians have been vaccinated, and that is a long way away. So just to run through a few things. Today we've recorded 2 internationally acquired cases of coronavirus. One is a teenage girl and one is a woman in her 30s. Both are now in hotel quarantining. One of these cases was diagnosed as a member of an international flight crew who was quarantining in a hotel at the time of her diagnosis. That crew member arrived in Australia on a crew-only flight with no passengers. The other members of the flight crew all tested negative and have since left the country also on a crew-only flight to complete their quarantine in their home country. One local close contact who transported the crew from the airport to their hotel has been identified, and that person is now required to quarantine for 14 days. This brings the number of internationally acquired cases since Victoria commenced receiving international arrivals to 10. So just a few comments on the New South Wales situation. We now have a permit in force for all New South Wales residents travelling to Victoria and residents from other states travelling through New South Wales to Victoria, and Victorians who have visited New South Wales and are returning home. It came into force at midnight last night. Anyone who tries to enter Victoria from the Northern Beaches and other New South Wales exposure sites, the red zones, will not be permitted to enter. If passengers do arrive from a red zone, they will be transferred to hotel quarantining for 14 days for the duration of that quarantine period. Anyone travelling from Greater Sydney region, the orange zone, is encouraged to get tested on arrival and self-quarantine until they receive that negative test result. Those travelling from regional New South Wales, the green zone, are permitted to enter and go about their business, but are asked to monitor for any symptoms. All travellers will be asked to carry their permit when flying, and the flights are being met by members of our public health teams, be that at Tullamarine Airport, at Albury, at Mildura, at Bendigo and at Avalon regional ports. So far, some 52,000 permits have been issued since midnight. That's at the rate of about 250 permits a minute. There is, of course, significant risk that COVID-19 has seeded across the Greater Sydney area. If that is the case, and I stress that's an if, then we will have no choice but to declare all of Sydney a red zone. That will mean anyone who has been in Sydney will not be allowed into Victoria. My message to everyone in Victoria is don't go to Sydney. And if you are prepared to do so, then be prepared to be stuck there for at least a period of time if the red zone designation expands to Greater Sydney. In regards to the operations at Melbourne Airport, 2 unaccompanied minors arrived from the red zone this morning and have now gone into hotel quarantining with their carer, who was self-isolating in Victoria after yesterday's announcements. That means that that family from the red zone will be spending Christmas in hotel quarantining. So my message to anyone in the red zones of Sydney is if you come to Melbourne, you will be spending your Christmas in hotel quarantining. That's not a position we want anyone to be in. Testing sites have also been established for travellers at Tullamarine Airport, There's a testing site at Terminal 4 for domestic arrivals. That's been operational from 9 a.m. At Terminal 1, there's a domestic site for domestic arrivals. There's a testing site for domestic arrivals, and that will be operational from 2 p.m. There's also a testing site at Building 64 at the airport for airport staff. Testing will also be available at Avalon, Mildura and Bendigo when flights are scheduled to arrive at those ports. The Health Department has been contacting all airline passengers who arrived from New South Wales and arrived into Victoria after the 11th of December. Any passenger who has travelled from the Northern Beaches and other New South Wales exposure sites from the 11th of December will be required to get tested and self-quarantined for 14 days after the day they were in that the latest date they were in that red zone. Text messages have been sent out to 11,000 arrivals in those period between the 11th and the 17th of December, and a further 7,000 are going out as we speak. The COVID-19 accommodation program has accepted a frontline worker and a community member into the emergency accommodation as a result of those messages. The frontline worker is a Victorian healthcare worker who is a close contact of the Northern Beaches cluster and was not able to safely isolate at their own home. And the community member recently arrived in Melbourne from Sydney. They are also a close contact of a Northern Beach cluster positive case and were also not able to safely isolate at home. Emergency accommodation is available for people in Victoria or who have travelled to Victoria from within Australia. If you need support to self-isolate or to quarantine, it is available. So just in regards to the situation in Sydney more generally, we can't rule any actions in or out when it comes to further tougher measures that might be needed. Those tougher measures will be on the basis of the public health advice. We are working very closely with our New South Wales and interstate colleagues, literally a hour-by-hour monitoring of the situation. And when the public health advice changes to take further action, we won't hesitate to do so, because we want to make sure that Victorians have a COVID-safe Christmas, and that precious thing that we have established of 50 straight days of COVID-free in the community transmission is protected and built on. And that's a challenge for all Victorians, but it's also a challenge for our friends and colleagues and family members, particularly in Sydney, and we'd ask them, please don't come to Melbourne, please don't come to Victoria, and Victorians, please don't go to Sydney. So I'll ask Professor Sutton to perhaps give a public health advice on the matter. Thank you.
Thanks, Minister. So obviously the situation in Greater Sydney continues to evolve. There's been an update from the Premier and Chief Health Officer there this morning. Additional cases overnight, as you know, 42 is the total number of cases, including the case that's in Queensland associated with the Northern Beaches cluster. There will be further cases through the course of today, as has been flagged at that morning press conference. We need to check in on what those updates will mean for us. Really, it's a question of how concentrated those cases are in the Northern Beaches area. There are new restrictions that are now mandated for the Northern Beaches that will obviously help to control transmission there, but cases may well be outside of that greater Northern Beaches area. So if that's the case, we'll need to review that. We'll need to see what settings they might have been in, how many people might have been exposed, and therefore what the risk is in the Greater Sydney area as it applies to our current orange zone and the permit scheme. If there is transmission in the Greater Sydney area, we obviously need to reflect on that, and as the Minister has indicated, what that might mean for a permit scheme or a prohibition of people coming from Greater Sydney. But at the moment, it's very strongly concentrated in the Northern Beaches area in Sydney. That's a good thing in terms of managing transmission. But in recent days, people have moved about a great deal, and that means that may well mean that there are some settings outside of that area where other individuals have been exposed. Not everyone with COVID-19 is infectious, and so people can go to some of these so-called exposure sites and no further cases occur. But if someone's infectious and they've been to a place with a great number of other people, then you can certainly see spread outside of those settings. So we just really need to follow that moment to moment and make a judgment through the course of today and the rest of the week.
So, any questions?
Minister, you've spoken a lot about airports. Presumably, as we speak, there's thousands of people driving down Hume towards Victoria trying to make it into Christmas. What is being done at the road borders?
At the actual borders, all people from New South Wales or coming into Victoria, regardless of where they're from, are required to get a permit. That's the first issue. And in regards to the policing of those, as we indicated yesterday, there are random spot checks being taken by Victoria Police, not on the hard border, but back further into Victoria, so as to make sure that our regional border communities can function as effectively as possible. That's based on the risk advice that it isn't those regional communities that are the threat. It's the, as we've heard so far, the concentrated cases in the northern beaches and potentially the wider Sydney community.
So the only safeguard we have against someone driving down from the northern beaches and coming into Victoria, into Melbourne, is a random spot check?
The evidence shows that overwhelmingly people from, whether it's into West Australia, Queensland and Victoria, that the travellers from the northern beaches areas are coming by plane. But in regards to anyone from those northern beaches areas, if you are leaving, you are breaching your own government's request, and as of 5 p.m. today, your own government's order that you not leave those areas. So if there is anyone from the northern beaches contemplating coming to Victoria by road, don't. You will spend your Christmas in hotel quarantining. If you come by plane, don't. As we've seen today, there is one family from the northern beaches area who will spend their Christmas in hotel quarantine in Victoria. That's in the interest and the safety of all Victorians and our hard-won effort to get to the position of 50 days straight of COVID-free.
How do we check? We do any checks on people? I mean, obviously, if someone's come since December the 11th, before the permit system was introduced at midnight, are there any ways of? Is there any way of keeping across those people?
Yes, those people have been contacted initially by SMS text messages, have been followed up with phone calls. Yesterday, we identified an initial 300 people from the Northern Beaches area in that group, and they are subject to both visits by authorised officers and check-ins by a phone, so as to make sure that that group are self-isolating and protecting both themselves and Victoria's hard-won status of 50 days COVID-free.
How did the two miners manage to board the plane in the first place, given they're in the care of airline crew, and we were told yesterday that they'd be checked at the Sydney end as well as here?
That's a good question. We're working with Melbourne Airport and the airline so as to establish how that happened. That clearly speaks to some issues at the Sydney end of things, and we're going to follow that one through to make sure that that doesn't occur again. However, I was really pleased that our authorised officers and our systems at this end of the system worked, and that we were able to identify those unaccompanied minors and their carer so quickly and get them, issue them detention orders and get them straight into hotel quarantining.
So their carer was already here?
Their carer was already here from that 11th of December to the 17th of December group, and as a result of their unaccompanied minors appearing in Melbourne, all from the Northern Beaches, all three have now gone into compulsory hotel quarantining for the next 14 days.
Passengers at the airport are reporting that it's pretty loose, that they're not being asked to show any proof of where they're from, that they're worried that people from Northern Beaches are being allowed into Victoria.
All the advice I've got is that the system is working pretty well, that all the flights are being met by authorised officers or DHHS staff, all in full PPE, and that they're all being provided the material around their obligations and their requirement to provide their permits. And that's in fact how this particular family were identified.
You started this press conference by celebrating the fact we're now 50 days of no community transmissions. Why are we putting that at risk by not disclosing the border now?
Well, we're working on the basis, as we always have, of taking the best public health advice in the most timely manner. We will not hesitate to take any measure that is needed if that's recommended. At the moment, the recommendation is to deal with the hot zones, the red zones, in the northern beaches local government area in particular, but a number of other and an increasing number of other exposure sites across Greater Sydney. If the evidence points to seeding of the virus across Greater Sydney, then that will see, without hesitation, the advice, if it's made by the public health teams, to treat Greater Sydney as a red zone, then we will act. And that will mean that anyone coming from Greater Sydney will be spending their Christmas in Melbourne or in Victoria in hotel quarantining. That's not a Christmas that anyone wants, so I'd urge people from Sydney to please reconsider your plans and not come to Melbourne, not come to Victoria, and people from Victoria, I know it's not the message we want to be hearing at this time of the year, but please reconsider your plans of travelling to Sydney.
Isn't that waiting for the horse to bolt, though, by the time all of Sydney is declared a red zone?
No, I don't believe so, because we're working very closely with our Sydney colleagues, and it is literally an hour-by-hour conversation as to how the epidemiological evidence shows where the outbreak is. And as we've seen today from our New South Wales colleagues, all the cases are able to be linked back to that cluster around the Avalon Bowling Club and the Avalon RSL, either directly or indirectly. Having said all of that, increasingly, as Professor Sutton indicated at this time of the year, more and more people are moving around, and as this virus takes a period of time to incubate, if there is any evidence that the areas of Greater Sydney have had the virus seeded into them, then I'm sure our public health officials will consider that, and if that evidence is there, then we will act on that evidence.
Just to confirm, you said that people from the orange areas are encouraged to get tested. So when they arrive at the airport, is that just optional whether they go to these testing stations?
So that's correct. If you're in Victoria at the moment from the 11th to the 17th from Sydney, then you need to get tested, or you're strongly encouraged to get tested. We've seen a high uptake, actually, of those people getting the advice at the airport. For instance, we saw a bit of a backlog at the Royal Melbourne Hospital as a stop-off zone as people were coming from the airport to get tested. We quickly moved with our friends at the hospital and dealt with that, and I'd encourage anyone who needs to get tested. There are up to 200 testing sites right around Victoria. Just hop onto the department's website, coronavirus.vic.gov, and you'll find the one closest to you. And I was pleased to see, in a way, that there was that drop-off point from the airport. It shows the system is working, as does the capture of the international person, flight crew person, as does the identification of the family from the northern beaches. Our systems are in place. They're always being tested. They're always being reviewed, and we'll continue to build them, as you would expect a high-performance response that we have in place and continue to build to respond to.
Right, a couple of questions.
Sure.
Would it be fair to characterise the situation as you would expect if we need to move to putting Greater Sydney as the red zone, that would happen likely in the next 24 to 48 hours, pretty quickly?
I think we'd consider it at any point into the future. At the moment, it really does depend on those day-by-day numbers. Yes, it's in consideration, it's in play over the next 24, 48 hours, absolutely. But if it stabilises and then goes awry later, it's still a consideration. It'll always be a consideration. but we're watching extremely closely over this next 24, 48-hour period for sure.
And what about the rest of the state? Do you think it's unlikely that the whole of New South Wales would be, would close the border to the whole of New South Wales?
Well, I think if that's felt to be a requirement, yes, we would. The reality is Greater Sydney went through months and months of low-level transmission, including up to 10, 15 cases average per day, without significant seeding into regional New South Wales. So that's worth reflecting on. But it's also absolutely the case that over the Christmas period, people will be moving into regional New South Wales more than they might have 3 months, 6 months ago. So we have to bear that in mind. If there were any cases in regional Victoria, we'd review on that basis as well. And if we have to make a hard border at the border, we'll do that.
How are you feeling? I think everyone in Victoria had a collective sense of relief, but now it's almost, we were discussing, it's like we've got a bit of post-traumatic stress. How are you feeling having to go into this again just before Christmas?
Nobody wants this to be the case in Australia. Nobody. Certainly not Sydney and Victoria. Having made the enormous sacrifices we have made, there's no question that we want to be as precautionary as we possibly can be. It's also a reality that our border communities have actually been hit as hard as anyone in Victoria, economically, financially, in terms of work and the constraints that have been placed on them. So we need to have a consideration about what the actual risk is just across the border in New South Wales, and regional New South Wales is not anything more than a negligible risk at the moment, I think. But we do have to consider protecting the status of Victoria as COVID-free in terms of community transmission, and we'll be appropriately anxious about that, because we don't want seeding into Victoria, and of course we've got in mind everything that we've been through over months.
Could we have cases here already? That's what people are
I think it's unlikely. There's one case per 10,000 people in the Northern Beaches. It's a population of 250,000 people. Many thousands are stepping up for testing in that area right now. So I think, especially those who are symptomatic, but even those who are not, are being tested. And so, that's terrific in terms of finding out where cases are. And obviously, their close contacts are being quarantined, and we'll watch that very closely. So the risk is there. But I think it's very low, and obviously we're placing strong obligations on people not to come. They will go into mandatory quarantine if they arrive here from the Northern Beaches or other hot spot areas. But also there are penalties that can apply. There are fines up to $1,600. There are penalties up to $9,000+. So those are also available for people coming in on flights or crossing a land border without a permit.
Is there any consideration to implementing some minor precautionary measures, such as wearing masks again in pubs and restaurants or something like that?
Look, in pubs and restaurants, it's less of an issue because people take them off to eat and drink. We've talked about it in indoor places that are highest risk, and I think that's in place in Victoria. It's the only place until today in Northern Beaches where masks have been mandated. And it applies to large shopping areas. I think there's still a very strong culture in Victoria of wearing masks when you can't physically distance. I think that'll continue to be the case, and that's a great insurance policy. We've also introduced from midnight tonight a requirement to wear masks mandatorily in airports, domestic or international. So that'll also be in place, and I think that's another risk mitigation.
So it wasn't mandated before? We were a bit confused.
Not for airports, no.
I think Melbourne Airport has this fantastic. Were you disappointed to see the number of people at the airport today coming in from Sydney, despite the warning yesterday?
I understand that people are trying to get home. These are people who probably left. Clearly they shouldn't be coming from the Northern Beaches area. They're all being individually assessed, and I think that's a strong check by our authorised officers for each and every person who's arriving. I understand that people were wanting to get home. Of course, we're going to continue to strongly recommend all of those individuals to get tested if they're from the orange zone of Greater Sydney. But it's understandable that people are wanting to get home again.
Do you fear that while people have been mostly compliant with the rules throughout the year, because we're at the time we are, people want to reunite with family for Christmas, they're also over it because of the year. do you fear that this might be the time when people don't do what they're told as well as they were?
Oh, I think Victorians are probably the most compliant, having been through everything we've been through. Christmas is a time for catching up with people. Again, I'd really recommend that people who've come from that Greater Sydney area are getting tested regardless of symptoms. And if you're symptomatic, you really can't be seeing relatives. You're putting them at risk, and nobody in Victoria wants that to occur. So I think overwhelmingly Victorians will do the right thing. We've got antennae for this more than anywhere else in Australia.
I guess my question before was, sort of more broadly, it was around, is there any consideration of implementing more precautionary measures here in Victoria? I use masks as an example, but is there any other thought to increasing that sort of level of safety?
I don't think so, not at this stage. We'll consider it as we need to, but the focus is on where the risk is. The risk is in Sydney, in the Northern Beaches area. That's where we're placing our mitigations at the moment. If there were anything to consider, because we think that risk has been imported into Victoria, yes, we'd review that. But Victorians are, as I say, pretty alive to this risk, and they do the right thing in terms of their individual behaviours, and the rest of the settings are really that balance of the insurance that you want by not having unlimited crowds indoors, and continuing to have caps for events, continuing to have the density quotient in place, but they're proportionate measures at the moment, I think.
The aircrew member who has tested positive, are we confident, comfortable that that person had been quarantined properly, that they hadn't left their hotel room? Because obviously it's before the new measures which are in place, as we say.
Yeah, we are. That said, we're always alive to needing to review each and every case that might arise in aircrew. The testing program in Victoria, again, strongest in Australia. If we identify further cases, we'll go through the same process of a detailed interview. It's usually only other aircrew who are potential contacts. Everyone else who's interacting with them is maintaining that distance, wearing PPE, including those hotel staff.
And the Australian Open was announced today that players are going to be able to come. They have to go quarantine, but they are allowed out for 5 hours a day to train. What assurances can you give Victorians that that's safe?
They're very strict requirements. Clearly it's a balancing act in terms of maintaining those training requirements for the players, but they are, again, separated. There's bubbles within the cohorts in the hotels. There are quarantine requirements for the physiotherapists who need to attend to them. All of the time that they're spent training is observed to make sure that they're not mixing, and the few close contacts that they have in those bubbles become the close contacts if anyone tests positive, and they all get mandatory quarantine as a result, and obviously can't be part of the competition. So they're very strict rules. We've worked them through in very fine detail with Tennis Australia, and it's all been agreed to. So I think we're managing a pretty tricky situation in terms of the requirements of the players to be able to train, but we are not cutting any corners in terms of managing that risk of transmission.
Are you worried that they come through Sydney? Some of those players will come through Sydney. Is that a concern?
No, I don't think so. They'll come through without mixing with the general Sydney population, and then they'll be straight into quarantine in Melbourne for that 14-day period, and they won't be playing that competition until there's a completion of that quarantine. And so at the point that they're involved in the competition, they won't be a risk to anyone.
Isolation and of air crews and the enforcement of that isolation seemed a little bit fluid in the last 24, 48 hours in the wake of all this. Where have we landed with that?
Certainly we're consolidating the accommodation for airline crew. They're going to be concentrated in a specific hotel. The application of infection prevention and control guidelines will be strengthened. The compliance and enforcement oversight will be strengthened. And we've got a testing program that's going to apply to those crew as well, and we've identified someone by virtue of the testing program being introduced. So I think all of those are additional measures that will make it safer.
So will police be watching that? Like police will
So it's
this hotel?
look, it's not the COVID quarantine Victoria mandatory quarantine process. It's not the same with floor by floor monitoring. These are air crew who are really spending their entire lives working and quarantining, and so they need to be able to manage that in a way that is sustainable for them. That applies in New Zealand, it applies across Australia, but we are assured by the airlines that they are following those procedures strictly, and there is another level of enforcement whereby anyone who's breaking the rules will not be allowed to be part of flying if they can't be trusted. But every indication I've got is that they're trying to do absolutely the right thing and are doing the right thing. That doesn't mean the risk is zero for internationally based crew in particular.
Yeah, it seems like a real soft spot, doesn't it? Like, I know Victoria, we're new to this again, but how is this not being sort of looked at and covered at like elsewhere in Australia?
Look, it's always been covered. There was a balancing act again, because this is an essential service in order to get Australians back home, for example. And so the international air crew haven't been able to be watched from Victoria when they're on their international duties. So we have to try and mitigate the risk for them in their home countries while they're in Australia to the fullest extent possible. And we've always gone through a review process. We've talked about it at AHPPC, where all Chief Health Officers come together to discuss it. And these are some of the additional measures that we're reflecting on now that we're really in a state of no community transmission. That's appropriate.
And can I just one more sort of numbers thing. You mentioned the unaccompanied minors this morning. Are there any other people from the red zone quarantining at the moment?
Yes, there are. There just a couple. I think there's only two who are known close contacts of cases who've identified themselves, either in response to the text message or calling our hotline, and who are quarantining appropriately.
So the two plus the two unaccompanied minors.
That's right.
And the family.
Yeah.
Right. And the family of the minors, I assume, will have to cover the cost of that.
No, that's an international quarantine arrangement only under law.
Mum was already here, or the carer.
But now all three of them are in mandatory quarantine.
Yeah.
So who pays for that?
But I don't think it applies for domestic quarantine arrivals.
So Victorian taxpayers are going to have to cover the cost of their quarantine?
For that family, that's my understanding.
So, can we clarify, or can someone come back to us with the exact numbers on...
Yeah, I'm sure we can.
So,
Yeah. Yes.
I've got another question for Mr. Foley,
Sure.
just on a few other than that. I'll just back on the tennis again.
Yep.
I guess, how's the government feeling about it proceeding?
Oh, look, I want to thank Tennis Australia for the constructive way that they've engaged. They've accepted the inviolable principle that infection prevention and control is at the heart of this arrangement. Everything else comes second. And tennis and both the men's circuit and the women's circuit have been very professional in the way in which they've accepted that, and I want to thank them for it. This will cement Victoria's position as the major events capital of Australia in really challenging circumstances that we've pulled this off. I want to thank Craig Tilley and his crew for the way in which they've engaged with our public health team. And I do also note that as part of this arrangement, it consolidates Melbourne Park as the home for the Australian Open for an even longer period. So I think that's a really good thing as well.
How is it fair that tennis players get 5 hours of training a day, but other people who are in quarantine in Victoria barely get any fresh air?
It's how the risk gets managed. This is an event that drives Melbourne's status as a major events capital and provides the jobs of hundreds of thousands of Victorians. That's not an unimportant consideration here. The main consideration is the public health protection, and that's at the heart of this arrangement. And the arrangements for how the professional tennis players, as Professor Sutton has indicated, manage under really strict circumstances that 5 hours a day that they're allowed is to reflect the fact that these are the world's most elite performance athletes. And to be able to perform at peak level safely in a quarantine environment, this was a sensible risk mitigation effort. And I think all Victorians, and indeed all Australians, would recognise that that's an arrangement that is in everyone's interests. Infection prevention and control is at the heart of the arrangement. It allows the world's best tennis players to come here, to isolate for 14 days under really strict conditions, separate to the bubble and the numbers that we've agreed with the Commonwealth who are coming in, and we are confident that the Commonwealth will approve those arrangements, that these players are in addition to Melbourne's numbers of returnees. So this is not at the expense of returning Australians. And we look forward to Victoria and Melbourne continuing to be the tennis capital of Australia.
People coming down from Sydney to watch the Boxing Day test and sit amongst 30,000 other fans, what do you say to them? Are they welcome?
So I say to people from the Northern Beaches and exposure sites, you're not permitted to leave your areas by your own government now. When this is all over, we look forward to you coming to Melbourne and enjoying the cultural and sporting capital of the country. But at the moment, please don't come. It's not in your interests, and in particular, it's not in Victoria's interests. If you do come from those red zones, you'll be spending your Christmas in quarantine. And if you think you're coming to the Boxing Day test, you'll be spending your period in quarantine hotels. That's not a risk that is worth taking. And should the situation spread beyond the identified areas, then we'll have more to say about that at the time. So I'm looking forward to the 30,000 cap at the G applying pretty well, and I'm pretty sure that the cricket ground won't have any trouble in selling 30,000 tickets for the Boxing Day.
You just mentioned the red zone, though, like from the orange zone. Is it the same situation? You know, please don't come. Our general proposition to all people from Sydney is if there's a choice between coming and not coming, don't come. Please don't come. We know that's disruptive. We know that's tough. And we know that's not the message that so many families want to hear. But it's in your interests and it's in Victoria's interests. So I know it's a tough message, particularly at this time of the year, but please don't come.
Is the Sydney situation the reason why we still don't know crowd limits for the Australian Open?
Well, that's still some way to go through. So what we've agreed with Tennis Australia upon the public health advice is those quarantine arrangements and a whole heap of principal arrangements about how the tournament will operate. There's still a lot of work to be done about applying those principles, but those principles will be essentially determined by the public health team, and we've got to work through those in a really strict operational sense with Tennis Australia. And again, I'm confident that that can be done. It was important to get the message out to both fans and to players that the tournament is going ahead. The quarantine arrangements are settled, and we'll work through the really fine operational detail over the next few weeks. There's still plenty of time before February the 8th, and the Australian Open will be a safe, COVID-safe tournament, but it will also be a fantastic event for tennis lovers.
And can I just go back to the permits? Everyone from New South Wales needs to get a permit, right?
Yep.
What's the point of telling them to get a permit if there's no one there to actually check? Again, going back to sort of the road borders.
Because we're all in this together. But the people of New South Wales, the people who want to come to Victoria, if you're coming through New South Wales, if you're a Victorian coming back home, everyone has sacrificed so much over the course of 2020. It is in our interests to make sure that COVID-safe status, 50 days of hard-earned COVID-free environment in this state is maintained. As we've shown, if you breach those arrangements, you'll be spending Christmas in a quarantine hotel. That's not how anyone wants to spend their Christmas. And if you want to take a punt that you can get in, just be prepared for the fact that you'll spend Christmas in a COVID hotel. There's random checks going on over those road entry points. If that needs to be beefed up upon the advice of the enforcement agencies and the public health agencies, it will be. All the evidence shows that the most risky points continue to be airports. And that's where our emphasis is. And as we've seen today, whether it be the family from the Northern Beaches or yesterday, the international the international airline crew, the system is working. There is always an assessment as to what we need to do further to protect that hard-won status. And if at any point we identify further measures that need to be taken, they will be taken, and they'll be taken very quickly.
Just a quick question on Dandenong's had a facelift.
Oh yeah, they have had a facelift. Just bear with me. Well spotted. So we're really pleased that a $600 million investment with Capital Alliance will transform the heart of Dandenong. This fantastic announcement, which levers off our investment in the public transport hub in Dandenong, will see civic spaces, it will see homes, it will see public spaces, it will see a wonderful Indian retail and community space created, and it will really vitalise that Dandenong area, and it will drive jobs, it will drive investments, and it will drive a much better future for the great people of Dandenong and the city of Greater Dandenong. Well remembered. We all good? Thanks everyone.
Thank you.